In addressing the place of global health in international affairs today, I'm speaking about success, shocks, surprises, and moral vindication. The 21st century began very well for public health when the governments of 189 countries signed the Millennium Declaration in year 2000 and committed themselves to reaching its goals. They launched the most ambitious attack on human misery in history. The contribution of health to the overarching goal of poverty reduction was firmly acknowledged, as was the need to address the root causes of ill health that arise in other sectors. World leaders were optimistic, visionary, and determined to see their visions realized. David, you are absolutely correct. This morning, the UK government once again shown its leadership. UK, you should be proud of your government, is one of the leading lights in global health. This morning, the target was to get 3.7 billion. They exceeded that target. The pledge totaled to 4.3 billion. So I want to take this opportunity once again on behalf of all the countries that will benefit from the generosity of your citizens and citizens of other countries for what you're doing. You're doing the right thing. You're doing the right thing to prevent diseases and deaths in children and in mothers. As I said, since year 2000, because of this very high-level political commitment, and a lot of money went into it, ODA more than tripled. A host of global health initiatives sprung up, and many designed to deliver life-saving interventions on a massive scale. New financing instruments were created, and clever ways were found to secure new money for purchasing medicines and vaccines. Presidents and prime ministers launched international programs for diseases rarely seen within their own borders. Official development, as I have said just now, more than tripled. Yet, unmet needs for new drugs and vaccines drove the creation of a new breed of strategic R&D partnerships that have already licensed very impressive innovations. Not surprisingly, this desire to cooperate internationally for better health, these innovations, these dramatic increases in resources had an impact. The number of people in low and middle income countries receiving antiretroviral therapy for AIDS moved from under 200,000 in late 2002 to nearly 7 million people today. And the number of under 5 deaths dropped to its lowest level in more than 60 years. The number of people newly ill with tuberculosis peaked and then began a slow but steady decline. And for the first time in decades, the steadily getting worse situation in malaria turned around. Countries follow WHO recommended strategies. They are seeing drops of 50% and higher in malaria deaths. I personally visited hospitals in Tanzania. To my horror, well, actually, I was very happy to see that. The pediatric ward, the beds were empty. What a joy. Now, as I said, yet for much of the decade, the number of maternal deaths stayed stubbornly high. This is something we need to work much harder. The explanation is not difficult to find, ladies and gentlemen, because reaching the goal for reducing maternal mortality depends absolutely on strong and accessible health services. The strengthening of health systems was not initially a core purpose of most of the single disease global health initiatives, but it is now. As the drive to reach the goals taught us, commodities like pills, vaccines, and bed nets, and the cash to buy them will not have an impact in the absence of delivery systems that reach the poor. This morning, I learned one sentence. They said, Mr. Gates, vaccines themselves do not move to the children's arm or the thighs. You need a delivery system. So true. Now, ladies and gentlemen, when the overarching objective is poverty reduction, I always argue, if you miss the poor, you miss the point. In my personal view, one of the biggest bonuses of all this progress came in the form of a frank recognition in the large single disease initiatives in the Global Fund and in the Gavi Alliance that goals cannot be reached and progress cannot be sustained in the absence of well-functioning health systems. I see Richard Horton in the audience. Richard, you still recall the very difficult meeting we had in Venice on arguing very strongly that you will not reach the Millennium Development Goals if you do not strengthen the health systems. I think, the tide has turned now, and I'm so happy. Richard, you should get some credit for it, but not too much. I believe this renewed focus on health system is one reason why the 2010 estimates finally show a significant worldwide drop in maternal mortality, with the greatest declines of around about 60% reported in Eastern Asia and Northern Africa. Like others, WHO welcomed last week's news of dramatic price reduction for vaccines sold by pharmaceutical industry to the developing world. So GSK should be commended for their corporate social responsibility. And this represents a sea change in the pharmaceutical policies. As one chief executive stated, and you know who he is, the pharmaceutical industry can no longer view itself as detached from the well-being of society. Not all the news is good, of course. Many countries will not reach the Millennium Development Goals, especially in sub-Saharan Africa. But striking progress over the past decade tells us two things. First, investment in health development is working. And second, despite the many crises and obstacles thrown our way, the high place of health on the development agenda has held very steadily, and the momentum to improve health outcomes has preserved. But so much for the success of public health when left to its own devices. Ladies and gentlemen, the year 2008 will go down in history as the tipping point that demonstrated the perils of living in a world of radically increased interdependence. That year experienced a fuel crisis, a food crisis, and above all, a severe financial crisis. That year also demonstrated that these crises are entirely different from those experienced in previous years. They are not just temporary dips and blips in the up and down cycle of human history. Their origin are so deeply embedded in the international systems that govern today's interdependent world, and that we must begin to accept. These are recurring if they are not going to be permanent features of life in 21st century. Let's hope not. These days, the consequences of an adverse event in one part of the world are highly contagious and profoundly unfair. In terms of impact, the financial crisis has behaved roughly like the economic equivalent of a drive-by shooting. The innocent bystanders, the countries that manage their economies well, have also been hit hard. In a similar way, the countries that contributed least to greenhouse gas emissions are being the first and hardest hit by climate change. 2 months ago, the World Bank and the IMF cited skyrocketing food and fuel prices as the most serious immediate threat to developing countries, and warned that we could lose an entire generation of the poor. At WHO, we have been advised by outside experts to accept financial austerity as the new reality. We have done so, and this has added urgency to the sweeping administrative, managerial, and technical reforms being introduced in WHO. And under the conditions of this century, the health and economic cost of chronic diseases has created an impending disaster. I don't like that word. Some people call it epidemic, some people call it pandemic. So choose whichever one that you pleases. But is a big deal. The NCD is a big deal. The burden of these diseases, heart disease, lung disease, diabetes, cancers, the burden has shifted from rich countries and rich societies to the developing world, where nearly 80% of mortality is now concentrated. Most health systems in the developing world are designed to manage brief episodic illnesses from infectious diseases. They are entirely unprepared to cope with the demand and the cost of chronic, sometimes long-term care. Prevention, of course, is by far the best option. Unfortunately, the forces, let me emphasize, that drive the rise of chronic diseases, including demographic aging, rapid urbanization, and the globalization of unhealthy lifestyles, lie beyond the direct control of the health sector. So, Minister, you don't have much control there. I'm sorry for you. But it is my sincere wish that the September high-level meeting on non-communicable diseases in New York will produce broad-based plans for urgent action. To combat the rise of these diseases, policy in other sectors like food, agriculture, trade must change. Using the WHO Framework Convention on Tobacco Control, the world must get tougher in resisting the increasingly very aggressive tactics of the big tobacco. They are attacking my countries. Uruguay, Norway, and Australia are being sued by the big tobacco for taking appropriate public health actions to protect their people. We can't accept that. This is unacceptable. Ladies and gentlemen, we are just halfway through this year, but 2011 has already delivered an unprecedented cascade of calamities, catastrophes, and humanitarian crises. We are seeing waves and waves of social unrest in Middle East and in parts of Africa. Haiti and Pakistan are still suffering from the mega disasters of the previous year. In March, Japan was hit with the triple tragedies of a magnitude 9 earthquake, a massive tsunami, and a related accident at a nuclear power plant. Some countries are now questioning the safety of nuclear power and rethinking their energy policies for the future. In May, an outbreak of a rare strain of E. coli began in northern Germany. The strain had been detected in isolated human cases before, but had never been associated with an outbreak of this magnitude. Today, cases have been detected in 15 countries or more. Almost all patients had a recent travel history to northern Germany, and many have required intensive care, and many died. This event, I argue, demonstrates how rapidly a disease can spread in our highly mobile world. It shows how difficult it can be to pinpoint the source when investigations are complicated by the intricacies of world food trade. And it tells us how much outbreaks can cost economies. With EU official estimates, every week, farmers lost to vegetables of more than $610 million. That's huge. Ladies and gentlemen, at the outset, I mentioned moral vindication earlier. Our world is dangerously out of balance. The gaps in health outcomes within and between countries are greater now than at any time in recent history. The difference in life expectancy between the richest and the poorest countries exceed 40 years. Annual government expenditure on health range from as little as $1 per person per year to nearly $7,000 per person per year. A world that is greatly out of balance is neither stable nor secure. Perhaps the biggest lesson from all these recent events concerns the impact of social inequalities on national and international security. In their analysis of the recent waves of social unrest, top experts from around the world cite vast inequalities within and between countries, of course, in opportunities, especially for the youth, in income levels, and in access to social services as the root cause of unrest and protests. Some cite the crumbling of public health services after years of utter neglect, so that the best care goes to the elite, and the poor pay unregulated, exaggerated prices for even the most routine care. In one speech, editorial, news reports, or article after another, we hear that greater social equity and some people would like to use the term equality, must become the new economic and political imperative for a safer and more secure world. This is nothing new for public health, and I commend my fellow colleagues who commit their lifelong career to public health. We have been making this same point since the Declaration of Alma Ata. The MDGs are all about ensuring those who suffer the most or benefit the least get help from those who benefit most. And this is the essence of social justice and solidarity and human right. Again, we see how fragile our advanced, sophisticated, high-tech, intertwined modern world has become. As the climate slowly warms, some 44 million preschoolers are obese or overweight, and the social fabrics in so many places and countries begin to unravel. Public health has been on the right moral and ethical tracks for ages, and it is good to see the world's politicians and economists wake up and open their eyes to the moral imperatives that have always driven the best in public health and always will. Thank you.
Two of the government's highest priorities here at home are firstly to return the country to the path of economic prosperity, and secondly to give people, especially the poorest and most vulnerable in society, access to excellent health care with outcomes that are consistently amongst the very best in the world. Those two priorities are also present when we look beyond our own borders. We want to do everything within our power to bring sustainable growth to all the countries of the world and to the poorest in particular. And we want that growth to bring with it improving health outcomes that will in themselves underpin future prosperity. Why are these priorities so important? Why are we interested in the health and prosperity of those who don't live here and who don't pay taxes here? They're important because we understand that today, more than ever before, our national interest cannot be defined simply by what happens within our own borders, if indeed it ever could. Because the strength of our economy, the health of our society, the success of our nation depends on the strength of our partners around the world. Because we understand the fundamental importance to our long-term national interest of making the lives of others, wherever they may be, better than they are now. And one of the main ways of achieving this is through improving health. The health challenges we face in Britain, an ageing population, increasing costs of healthcare, a rising tide of lifestyle-related diseases, these are not unique to us, as Margaret so eloquently said. They are shared and international concerns. Across the globe, we share a common destiny. Borders are more open, travel is faster, more frequent and more affordable, normally. Our economies are more integrated than at any time in human history. This interdependence means that to a greater degree than previously imaginable, we share in each other's prosperity. And indeed, hundreds of millions of people who have been lifted from poverty in China in recent decades can indeed testify to that. But we also share the risks of failure, the risk of climate change, where the effects are felt by all, irrespective of borders, the risks of diseases and infections, and indeed, as H1N1 pandemic demonstrated, or as Margaret said in relation to the recent E. coli outbreak, it can spread very quickly from country to country. Or indeed, the risks of collapsed and failed states, bringing terror and conflict to the world. Acting alone in any of these respects is not an option. Acting together, acting in common purpose, that is the only way forward. Of course, especially in times of economic difficulty, as Margaret said, of financial austerity, all of us need to look to our own economic and trade interests. Without a strong economy, there is little we can do in any arena. I do want British companies, British healthcare organisations to succeed abroad, bringing more jobs and more prosperity to our people. We've seen some examples. Moorfields Eye Hospital has a new facility in Dubai. Imperial College Hospital operates a diabetes clinic in Abu Dhabi. They are pioneers seeking new opportunities on a global basis for the NHS. And indeed, by doing so, providing new revenue to fund better care for NHS patients. I want more of this. And some trusts with well-developed international reputations, such as Great Ormond Street Hospital, already treat many international patients here in England. Revenue, again, that is then invested back into the National Health Service to provide ever better care for NHS patients here in Britain. And the UK has long been a global hub for research and clinical expertise. The life sciences are of particular importance to our economy now and for the future. We want to build that base that we have had here for many years in the future, encouraging global leaders like GSK to build on their success, creating new jobs and indeed many new treatments. Always attracting new investment, always pushing the boundaries of medical science for the benefit of all, giving UK companies and NHS organisations that have so much to offer the world every opportunity to do so. And of course, with $3 trillion invested in healthcare each year around the world, it pays to be a major player. But above and beyond self-interest, there is enlightened self-interest. I'm deeply proud of the fact that Britain has forged a reputation as one of the leading voices and principal donors in international development. This is perhaps most obviously apparent in our commitment to lifting our development spending to 0.7% of gross national income, a commitment made by the last government at Gleneagles in 2005 and one that will be realised by this government in 2013. The international community can depend on the United Kingdom to keep its promises on development spending and to use its influence to encourage others to do the same. And we know what that will enable us to do, training midwives to help make childbirth the joyful experience it should be, instead of the potential death sentence it too often still is. Working to eradicate the scourge of polio and guinea worm disease, providing safe, fresh drinking water which can transform lives, not only through an almost instantaneous improvement in their health, but also by freeing girls, because it is invariably they who work so hard to collect it, to go to school or work, improving their lives and those of their families still further. And of course, vaccinating children against diseases like severe diarrhoea that, for the sake of a few pounds, would otherwise kill them. This has been a good month for progress in vaccinating children. Earlier this month, GSK announced that it would make its rotavirus vaccine available to Gavi for 2/3 the price at which it is currently available. And of course, at today's Gavi replenishment conference, I was delighted that the Prime Minister was able to announce an additional commitment of £814 million, an additional commitment. Money that between now and 2015 will help vaccinate over 80 million children and save 1.4 million lives. That's one child's life saved every 2 minutes. We, government and industry, understand that in the long term, their interests, the interests of those people whom we help, are indeed our interests, because their problems, left unchecked and ignored, will sooner or later become ours, whether we like it or not. For when people are poor, desperate and without hope, chaos can be close at hand. States that are today fragile can, without outside support, soon fail. And the risk of failed states are huge, unleashing fear and hatred that can bring terrorism or conflict, unchecked immigration or crime to our doorsteps. David Cameron said only last month at the G8 in Paris, if we had spent a fraction of what we are paying now in Afghanistan on military equipment into that country as aid and development when it had a chance perhaps of finding its own future, would that have not been a better decision? He's right. No country can escape the logic of global interdependence, accepting the bountiful pros while somehow avoiding the inevitable cons, no matter how much we might want to. So the question is If we are indeed all in this together, what should we do about it? Britain's answer is to make global health an explicit aim of our foreign and economic policy. At home, we are working to ensure that all relevant government departments work together, sharing information, developing common goals, and working to a shared strategy. Abroad, we need to work ever more closely with other governments and with international organisations like the World Health Organization and across civil society. Making and exploiting the connections between us, making the most of the talent, expertise and passion that exists in abundance out there in the world, putting that work to the benefit of humanity. 2 years ago, the H1N1 pandemic affected just about every country on the planet. The global response was swift, calm and impressive. I would like to pay particular tribute to Margaret for how she and her colleagues at the WHO handled that particular crisis. A crisis that throughout was characterised by a high degree of international cooperation, openness and trust. An approach I was pleased to see that was vindicated in a recent review of the WHO's actions. We, of course, were also lucky. That particular flu strain proved, in the event, to be relatively mild. Of course, we may not be as lucky next time. That is why all of us, countries together, must work together to develop adequate warning systems, to develop quickly and produce and distribute effective treatments, and to agree protocols of how the business of the world economy can be sustained during times of crisis. But we must also be clear as to the political and financial realities that donor countries face. Everyone is under pressure at the moment, under pressure to put aside their development commitments, to contribute less than they had promised, under pressure to turn their backs on free trade, to try to protect jobs at home by raising barriers to trade, under pressure to think of the national interest in the narrowest of terms. We must and we will resist those pressures. So here in Britain, we will not make the world's poor pay the price for the debt crisis by abandoning our commitment to the 0.7% objective. We will not seek the false shelter of protectionism. We will not close our eyes to the realities of a modern, integrated and globalised world. Instead, we are determined to prove to our citizens that the money they spend is making a genuine difference. That is why we updated the original Health is Global strategy through an outcomes framework for global health. Here in England, we are modernising the National Health Service. One of the most important elements of that modernisation is measuring how effective the NHS is in terms of the health outcomes it delivers for patients. So instead of saying that so many operations must take place, we want to measure, for example, the survival rates for those operations, to measure, to publish, and to improve. That way, not only can we in government, but clinicians, and most important of all, patients, see just how good services are. And if there is a problem, clinicians then will be challenged to sort it out. Such an approach in this country for cardiac surgery has halved death rates in England over the last 5 years. As at home, likewise abroad. The Health is Global outcomes framework brings tangible, measurable outcomes to bear on our efforts to improve global health, focusing on some of the greatest challenges to global health across key areas of, for example, global health security, health in development, and trade for better health. On food security, on access to affordable immunisation and treatment, on adapting to the effects of climate change on the health of the very poorest communities, and strengthening local health services to improve lives, reduce preventable deaths, and improve prospects for peace and security. In this way, working together across departments, we can focus our resources not only on what matters most, we will be able to see far more clearly whether or not what we are doing, whether the billions we are spending, is having the desired effect. And if it's not, we can adapt and change what we are doing. Taken together, the realisation that our interests reach far beyond both our own borders and our narrow, immediate economic interests, and the clarity of purpose that the Global Health Outcomes Framework brings with it, means the traditional approach to international relations is evolving. Global health is now central to effective foreign policy. You cannot separate health from security, not when so much of our security means preventing or dealing with the aftermath of natural disasters, of civil conflicts, or of pandemics. You cannot separate health from economics, not when a new pandemic could bring the global economy to an abrupt standstill, or when, positively, life sciences and health industries have so much to contribute to global growth and trade. And you can never separate health from our desire for social justice, for all people, from all countries, of all incomes, to share the dignity of good health. The World Health Organization will be central in tackling the challenges we face. I would like to applaud the determination and leadership that Director General Margaret Chan has displayed in helping the organisation adapt to the changing nature of these challenges. I hope that all countries will join the United Kingdom in integrating the global health agenda into all aspects of their foreign and economic policies, to continue to work together and with organisations such as the WHO to meet the Millennium Development Goals. For when we work together, everyone benefits. Thank you very much.